Good afternoon. My name is Michelle Lane, and I am the Senior Director for Community Health and Wellness here at North Kansas City Hospital, Meritas Health. And I am so excited to teach you a little bit about women and heart disease today. If you're joining us, this is Her Heart Matters, Women and Heart Disease. I have a huge passion for cardiac care, have been working here at North Kansas City Hospital for almost 30 years, and primarily in the treatment of heart disease and other factors affecting hearts and women in general. This presentation is going to be, an overview of the prevalence, the risk factors, symptoms, prevention, and some little takeaways that you can put in your pocket and help you along the way to preventing heart disease for you or for a loved one. So let's get started today. So this is some data that is a little bit startling, a little bit scary, but heart disease is the number one killer for American women. Every 3 seconds, a female dies from heart disease. Cardiovascular disease kills more women than all forms of cancer combined. Nearly half of the women at age 20 are living with some form of cardiovascular disease. And even more important is the fact that half of the women who have a heart attack have none of the typical symptoms that a male presents with. And 64% of women who die suddenly of heart disease show no prior symptoms. These statistics really highlight the critical need for awareness and action to combat heart disease in women. And I'm so grateful that you're here today with us. Hopefully there's something that you're going to learn that will be a nugget that you can take forward and share with others and allow this information to have a ripple effect with you and those around you. So, the thing about those startling facts that I just shared is that heart disease is also largely preventable. And I think that's one of the key takeaways. There are numerous things that can go wrong with your heart, from electrical activities to plugged up arteries to a pumper that doesn't work, a valve that doesn't close. There's so much that we could talk about today. But, the heart disease that I'm referring to is really, coronary artery disease. This is the heart disease that develops over years and is progressive when the heart doesn't get enough nutrients. And so that's what we're going to talk about today. I've got just a couple slides that talk a little bit about what heart disease is. It is the plaque that builds up inside your arteries that limits the amount of oxygen-rich blood that can get to all of your organs to help them do the things they need to do to keep you healthy. And so that's what we're referring to. This piece is really looking at heart disease that affects the vascularization around the heart. And, one of the things that's important to be mindful about, you may hear of somebody having a heart attack, right? And they have a blockage and they come to the cardiac cath lab or they come to the emergency department and they take them and they, can get it fixed, right? But, getting things fixed isn't really true. There is no quick fix to heart disease. It's a incredibly complex condition that often requires ongoing management and lifestyle changes. And so procedures may help alleviate symptoms or prevent the heart muscle from actually dying when it doesn't get a blood supply, but it does not cure the underlying disease. So you have to have continuous treatment and you have to have lifestyle adjustments along the way. The thing is if your body is able to clot off an artery before because you smoked, you overate, or you have a family history, or there's other lifestyle changes, if you continue with those lifestyle choices after you have formed, some sort of blockage and you get it resolved, your body will again make more blockages if you do not make life changes. So lifestyle changes are not only just part of the prevention plan for heart disease, but they're also part of the treatment of heart disease. And so that's important to remember. There are some risk factors that are completely out of your control. And I want to review them just real quickly and talk about the why. So family history of heart disease. Genetics play a significant role in heart disease. It's actually the number one risk factor. If you have a close family member who has heart disease, you may inherit genes that predispose you to conditions like high blood pressure, high cholesterol, or other cardiovascular issues. It is passed down in your chromosomes. Another risk factor that you have no control over, or I wish I had control over, which is our age, is that as you age, especially women, the risk of heart disease goes up. And this is partially true because of the natural aging process, which can lead to hardening and the narrowing of the arteries. But another piece that plays an important role is that post-menopause, the decline in estrogen levels also contributes to an increased risk of heart disease as well. A third risk factor that you have no control over is whether or not you had high blood pressure during a pregnancy. Conditions like preeclampsia or gestational hypertension, so this is high blood pressure while pregnant, can cause long-term damage to the heart and the blood vessels. Women who experience high blood pressure during pregnancy are now at higher risk for developing chronic high blood pressure and cardiovascular disease later in their life. Another risk factor you have no control over is when you started your period. You have a longer lifetime exposure to estrogen if you start your period when you're younger, which can increase the risk of cardiovascular disease. Early puberty, unfortunately, is also linked to higher body mass index or obesity and metabolic syndrome, both of which set you up for risk factors for heart disease. Another risk factor we don't have control over is endometriosis. Endometriosis is associated with chronic inflammation and higher levels of estrogen, which can contribute to cardiovascular disease. Women with endometriosis are also more likely to have risk factors like high cholesterol and hypertension. These guys are all buddies. These guys are sorority sisters. Where one goes, they all go. There is a very relational component to the risk factors for heart disease. Another thing that is a risk factor that you have no control over is menopause before 40. Early menopause results in a longer period without the protective measures of estrogen, and this can also increase your risk of heart disease. And then lastly, polycystic ovary syndrome. This is linked to insulin resistance, obesity, and metabolic syndrome, all of which are risk factors for heart disease. So women who have polycystic ovaries often have higher levels of androgens and lower levels of estrogen. And so these contribute to this increased cardiovascular problem that they may find in their body. So additionally, I think it's also important to note that there are some risk factors that you can control, right? And smoking is one of those low-hanging fruit. Smoking damages the lining of the arteries. It leads to the hardening and narrowing of these arteries. It also reduces the amount of oxygen in your blood and increases your blood pressure, increases your heart rate, all of which contribute to heart disease. But the important thing to note is that within 1 year of quitting smoking, your risk of heart disease goes down by half. That's incredible. I think it's also important to know that smoking is the most preventable cause of death in the United States. It's linked to 1/3 of all the deaths from heart disease and 90% of the deaths from lung cancer. So this is so important to quit if you can. Set a date, choose a method, go cold turkey, go gradually, find a friend to tell them to keep you accountable. North Kansas City Hospital has a smoking cessation program. It's from the Mayo Clinic. It's evidence-based. And if you need to know about that program, just reach out to me and I will give you all the information you need to get you the help so you can be successful in quitting smoking. A second risk factor is high blood pressure. High blood pressure can damage the arteries. It makes them less elastic and more prone to plaque buildup. And so high blood pressure is one of the leading risks for heart disease and stroke. Typically, blood pressures, or not typically, there are two numbers in blood pressure. The top number is the measurement of the pressure within the arteries when the heart is beating, when it's squeezing. The bottom number is the lower of the two, a smaller number, and this is the amount of pressure when the heart is at rest in between those squeezes, right? And so getting an accurate blood pressure is incredibly important. And there's some things that you may need to keep in mind and advocate for yourself when you go to the doctor or somewhere to get your blood pressure checked. You do want it to be done consistently so you're able to get the most accurate measurement. So 30 minutes before your blood pressure is taken, you want to make sure you have no smoking, no exercise, no sex, no caffeinated beverages, no alcohol. And when you arrive to get your blood pressure taken, sit down, be calm, don't talk, uncross your legs, feet flat on the floor. That's going to give you that best measurement that we can get. Rest your arm comfortably on a flat surface at your heart level. Sit upright, stay supported, and take 2 readings. Do it twice, 1 minute apart. I like to do mine in the morning before I take my medicines and then before I go to bed. Record these results because what happens is we go to the doctor's office and it may be a little bit elevated when they check us and we say, oh, it's white coat syndrome. And so we paw that off as not a significant high blood pressure. But slowly over time, that number may be creeping up as a baseline. But if you're not knowing your numbers, you don't know this. And, high blood pressure is a silent problem, but it is so deadly and causes so many other issues in the body that it's really important to make sure that you know this number. I like to think of blood pressure as, or having high blood pressure untreated is kind of like washing your Tupperware bowls and lids in the dishwasher too many times. The heart is a muscle. It can get stretched, right? It can get stretched out. When you have high blood pressure, it stretches out that heart muscle, okay? And a high pressure system will get this fat, floppy heart that doesn't squeeze well. Well, why does it not squeeze well? It doesn't squeeze well because the lid to that Tupperware, the lid to that heart valve, the valve is not muscle. It doesn't stretch. It's made of like cartilage. And so it stays the same shape. So your lids that you wash in the dishwasher may stay the same shape, but that bowl gets all Willy Wonka in the chocolate factory, and the lids don't close on it right when it goes to close and squeeze and get the blood out to all of the important organs in the body. And so when this happens, this is over time what causes congestive heart failure or heart failure, one of the reasons you can have heart failure. So you don't know what's happening, but that pressure system can affect you long term in a silent way. Another risk factor is obesity. Excess weight increases the risk of heart disease by contributing to high blood pressure, cholesterol, and diabetes. Remember, I said these guys are all friends. Obesity can also lead to inflammation and insulin resistance, which can damage the cardiovascular system itself. Physical inactivity is also a risk factor that you can control. The lack of exercise can contribute to obesity, high blood pressure, and high cholesterol. And I'm going to give you a couple tricks about how I get my movement in every day, and maybe it will resonate with you, but we'll talk a little bit more about that down the road. High blood pressure, is also a problem with diabetes. And so when high blood sugar levels are happening in your body, they can damage the blood vessels and they can damage the nerves that control the heart itself. Women with diabetes are at a higher risk for heart disease than men with diabetes. Okay, so we are at more risk as a woman with diabetes than a man with diabetes. And diabetes is on the rise. North Kansas City Hospital just completed a community health needs assessment. And one of the findings is that the diagnosis of diabetes has increased from 8.3% to 10.3% in the last 3 years in our population. So one of the things that we've done is we started doing hemoglobin A1C checks out in the community. So check out our class schedule where you signed up for this program and look under screenings. We've got free screenings for cholesterol. We've got free screenings for hemoglobin A1Cs, or in some instances, a $10 charge, which is still going to be better than scheduling a doctor's appointment, having a copay, going to the lab, and doing all that. You get that hemoglobin A1C result right away within 5 minutes. And so if you're working on something and you're wanting to get your sugars down or eating less carbs, come see us, because this is a quick way to get a fast measurement, evaluate it, and then come back in about 90 days and get that remeasured. So other risk factors that I think are important to note in relation to cardiac disease is sleep apnea. Sleep apnea causes intermittent pauses or breathing pauses during your sleep. This can lead to lower oxygen levels and increased carbon dioxide levels in the blood. And this puts extra stress on the cardiovascular system, again, leading to high blood pressure, leading to arrhythmias that can cause the heart failure or the stroke. There was a great study done, and I think it was Neurology Today where it was published. And this was a longitudinal study with sleep apnea patients. Simple variable, one was addressing their sleep apnea, the other was not addressing their sleep apnea. Longitudinally across time, they watched these patients, just whether or not they were addressing or not. If it was unaddressed, these patients died on average 7.5 years earlier than the patients that had sleep apnea that were addressing it. So very significant. Sleep apnea is a simple thing to evaluate. Now you can get a kit mailed to your house. You put it on your bedside table, hook yourself up, go to sleep that night. There's not some strange person in a room watching you sleep. If that's positive after you mail it back in, then maybe you need additional testing, but the screening itself is very simple. Another thing that puts us at risk for heart disease, a risk factor, is stress or depression. Chronic stress and depression can lead to increased levels of cortisol and adrenaline. That makes our blood pressure go up. These hormonal changes can cause inflammation and damage the arteries, and that puts us at risk for heart disease. Also, too much alcohol. Excessive alcohol consumption can lead to high blood pressure, cardiomyopathy, which is that disease I was talking about with the heart muscle, and arrhythmias. Alcohol can also lead to high triglyceride levels. So this can contribute to the buildup of plaque inside our arteries. A fourth risk factor that isn't often talked about is birth control pills. Hormonal contraceptives can increase the risk for blood clots in certain people, which could lead to heart attacks and stroke. This risk is higher in women who smoke or are over 35, but there is a risk factor there. And then lastly, we have to touch base on the risk factor of anemia. Anemia, particularly iron deficiency anemia, reduces the oxygen carrying capacity of the blood. So how oxygen moves around our body is he sits on top of the red blood cells like a little piggyback and floats through your body through the red blood cells. Well, if you have anemia, you have less blood cells, red blood cells in your body, so less little oxygen molecules being carried throughout your body where they need to go. So the heart has to work harder to supply oxygen to the body, which can lead to this heart that gets enlarged and fails over time. So those are some of the important risk factors that you have control over or you don't have control over. And sad to say, these risk factors also have what's called the multiplier effect. So one risk factor doubles your risk. Two risk factors quadruples your risk. Three or more can increase your risk for heart disease by tenfold. But the eureka moment and the most important thing is that just by doing four things, eating right, moving more, quitting smoking, and keeping a healthy weight, you can lower your risk for heart disease by as much as 82%. So this is, preventable in some instances. There are some key tests that you can have done to help monitor your risk for heart disease or heart disease as you go along. Remember, we talked just a little bit about your blood pressure. That's something you want to make sure that you are keeping track of. You want to make sure that you're monitoring your cholesterol. We do that free in the community at the Mid-Continent Public Libraries, the farmers markets, YMCAs, community centers. Go to where you signed up for this class, go to screenings, sign up and come see us and get your cholesterol checked. Point of care testing, you know your results before you leave. We're all health coaches and nurses, and we have nutritionists there that can talk to you about your cholesterol. But the most important thing with cholesterol is that ratio of good cholesterol versus bad cholesterol, because the good cholesterol can eat the bad cholesterol or absorb the bad cholesterol out of your bloodstream. Good cholesterol is the HDL. So think happy, and then LDL is lousy LDL. So it's important to know those numbers as well. Additionally, it's important to know whether or not your glucose is elevated. We talked a little bit about diabetes, but monitoring your glucose can help manage that diabetes and reduce your risk for cardiovascular disease. We talked about obesity. Make sure that you can, get your measurements done for your body mass index. One of the other tools that we use in the community for free is we bring this really cool special scale that gives 8 different points of measurement. One of which things it measures is the visceral fat around your organs. The visceral fat around your organs is directly tied to the longevity of your life. The more fat here, the less longer the less longer, I didn't even say that right. It affects your longevity in a negative way, if I could talk. But come see us, get these measurements. It checks bone density. It checks, all sorts of great things that you don't even know if you wanted to know. And, do some work and then come back and retest. So it's wonderful to be able to see progress and give you that extra oomph of energy that you need to continue the good work. Another test that can be done to monitor for heart disease is an EKG. So this is like 12 little stickers. They stick a couple on your feet and your arms and around your heart. And this is really important to get a baseline EKG after the age of 50. That way, when you're 55 or 60, there's this normal EKG when you were feeling, fine, that they can compare it to and see if there's been any changes over time. If you've never had an EKG and all of a sudden you're having chest pain and you come in, there's no baseline to compare that to. So it's important to get a baseline EKG. A stress test is also one of those wonderful tools to use in your tool belt. It evaluates how the heart is functioning under physical stress. It can reveal issues such as coronary artery disease or arrhythmias that may not be apparent when you're resting, but you put a little stress on that heart, get it pumping, and then it shows, some problems. And so this is really, really important with women, especially because our signs and symptoms are more subtle than what men have. And so it's important to get your stress test, but it's also important to get your calcium scan. A coronary artery calcium scan is a simple test. You don't need a doctor's order. It's $50. You can buy them online, make an appointment, come in, and they scan from here to here, and they're looking for blockages, calcium deposits along your carotid arteries and around your heart. I used to do this silly gift card exchange with my siblings at Christmas. It's like, oh, what do you want? What do you want? A bottle of wine, good whiskey, whatever. But one year I decided to buy calcium scans for all my siblings, $50, right? Now I forever have a brother that is in debt to me because he had blockages around his arteries, was able to go in and get this, fixed up, make some lifestyle changes, and is doing great and is able to help me move every time I ask that of him. So there is a return on your investment for these $50 cardiac scans. You can forever win somebody that owes you a favor if you buy them one. So those are some key tests that you can do for heart disease, to really kind of stay on top of it. Now I want to talk a little bit about the difference between heart attacks in men and heart attacks in women, because there are some differences. For men, it's more sweating. It is a pain in the chest and in the neck, and sometimes in the jaw, some shortness of air. Men seem to have some heartburn or indigestion. Women, on the other hand, are going to be displaying fatigue, dizziness, uncomfortableness between the shoulder blades themselves, shortness of breath, and maybe some indigestion or some gas-like pain. But that unexplained fatigue or sleep disturbance can be one of those telltale signs. I have to tell an embarrassing story about myself. I had an incident with my mother. She said she was having some tooth pain and she made a dental appointment, and it was just in conversation and in passing. Oh yeah, okay, blah, blah, blah. And she went to the dentist, and the dentist said, Bev, you don't have any problems with your teeth. They look fine. What else is going on with you? Well, she called me from the dentist chair. She was having a heart attack. And here I consider myself an expert, or volunteer to even teach other people about heart disease. And in my own view, is this situation happening? And I didn't even recognize it myself. So it's so important to stay on top of this and to know what the symptoms and risk factors are that you have for heart disease. There are many differences between men and women with heart disease. I want to kind of review some of them because I think they're fun and they're interesting. And, it may help you along your history and your path to know these things. So women in general have smaller hearts and much more narrow blood vessels compared to men. And this can affect how heart disease will develop and is treated. Men usually have that wider blood vessel, but not the narrower blood vessels like women. Cholesterol buildup is also different in between men and women. Women are more likely to develop cholesterol buildup in the heart's smaller blood vessels called microvascularization. And this condition is called coronary microvascular disease, compared to men who develop their plaque buildup in their largest arteries that supply the blood to the heart. And so that's an important difference between the male and the female heart. Additionally, women are more likely to suffer from conditions that mimic heart attacks, like coronary spasms, coronary dissection, or broken heart syndrome, where you have heart pain, but there is no disease and it is not being blocked off. Men are less likely to experience these conditions. That might be one of the reasons that women fail to reach out and get, assessments early, is because they think, oh, well, maybe this is just a spasm or, whatever it might be. But women have more of the diseases that mimic heart attacks. Additionally, hormonal influence is different between men and women. Hormonal changes, especially post-menopause, can increase the risk of heart disease due to the decline in the protective estrogen levels in the body. So estrogen can help maintain healthy cholesterol levels, it dilates blood vessels, and reduces inflammation. But men don't experience that same hormonal fluctuation that impacts the heart as women do. And then lastly, I think it's important to note that women historically have been absolutely underrepresented in cardiovascular research. This leads to gaps in understanding and treatment. I think I read somewhere that out of all the heart disease studies that's ever been completed, only 33% of the participants are females. And thinking about the difference between men and women in heart disease, this is significant. We need to be involved in these studies. As a follow-up from this talk today, I will record a YouTube version of this talk. I'll convert it over to YouTube. It's being recorded currently. And I also supply you with some of the tools and the screening events that we have coming up, so you can, put those on your calendar and make sure that you join us for some of those. But I'm also going to put in there a link to sign up to be involved in heart disease research for women. You can, later on decide your level of commitment to that, but it's important to get in their American Heart Association's letters and learn about the research that's going on related to women, so we can better our understanding of the difference. So I want to touch base on this. I know this may seem like this is redundant information, and we all know this, but we still have people that pause and wait before they seek medical attention. In order to survive a heart attack, minutes absolutely matter. Know the warning signs, call 911. Do not drive yourself to the hospital. And the reason we say this, because when you get in that emergency transport vehicle, they have a doctor on the phone. The medical, tech that's in the back can administer medications. He has a toolbox right there. You get in that vehicle, he's going to be able to put oxygen on you. He's going to do a 12-lead EKG that he's going to send to the hospital before you ever arrive. He can give you IV fluid if your blood pressure is low. He can give you medicines for arrhythmias. He can call and tell the hospital that you're on their way and that they can have all of the team and the cardiologist there ready to meet you. When you're driving in your personal vehicle, none of that happens. So this is a really important piece to mortality related to women and heart disease. Don't drive yourself to the hospital. And uncertainty is normal. Don't be embarrassed by a false alarm. It's embarrassing to say, but I have to share. I had an issue at home and I dialed 911. I thought that I was having a heart attack. Sincerely, it was very real and it was a panic attack. Was I embarrassed to have 5 emergency responders in my living room, all, doing things to me in my, in my state of fright and ability to calm myself down? Yes, but I'm alive to tell you that story. It could have very well been heart disease. You know what happened to my mom. I have a risk there and I have other risks. And so don't be embarrassed. You can laugh about it later and tell yourself a good story. It's also important to remain calm after you call 911. Open the front door if you can, or have somebody else open the door to make it easily identifiable for the emergency responders coming to your home. Flip on that outside light. Sometimes houses are not numbered, brightly or, seen well in the dark. And so that's important. Stay calm and use a breathing technique called the 3-4-5. I use this all the time because it's evidence-based. So what you do is you take an inhale for 3 seconds. You pause for 4 with that inhale inside your body. And then you let it out for 5. That long exhale, it does something so cool. It gets that sympathetic nervous system acting as a responder in the internal parts of your body to calm the nervous system. 3-4-5 breathing is a powerful tool. Should be in your toolbox at all moments, ready to bust it out. It is something that we carry with us at all times and we can do anywhere. So breathing is so important. So if you think you're having a heart attack, call 911. Don't let anybody else drive you. Open the door, turn on the lights, do your breathing. So I think it's also really important to keep this information as simple as possible. It can be overwhelming. Health, wellness, heart disease, so many things coming at you. Do we need to watch our cholesterol? Do we need to be fasting? How do we take care of ourselves? For me, I have to simplify this. And so I have simplified it to 3 things, not 30, 3. And, these are the things that I focus on. I can't look at all of this other superfluous data. I need to focus on these 3 things. It makes it easier for me. I didn't say easy. It doesn't make it easy, but it makes it easier. And, I think we're all busy. We all, don't have time to do any of these things, but, it is so incredibly important. So reduce the confusion. Don't worry about whether or not you should be doing weight training or getting your protein in. Am I sleeping enough? Am I getting light in the morning? Am I fasting? Whatever it is, focus on these 3 things. And I also think it's important to know that, this talk comes from the place in my heart of just trying to help other people. I don't do everything right. I have been known to absolutely crush a box of Cheez-Its laying in bed, watching Netflix. We're all human, but we can just do the best we can, and we can encourage each other, and we can share the things that are working well for us. And so that's really the space in which I'm sharing some of this with us today, because we know in our modern lifestyle that it's making us sick. Unfortunately, it is killing us. And not only are these 3 things part of the solution, they're part of the treatment. Food, movement, and sleep should be thought of as medicines. These are medicines, but we are not taught that. We're not taught to think of exercise as a medicine, but it is. What you put in your body and fuels it is a medicine. Your sleep affects so many parts of your body. And we're going to talk about each of these individually and talk a little bit about some of the things that I have found to help me in my journey towards health and heart disease risk reduction. So embrace healthy eating. I said it. The most important thing that you can do is eat minimally processed foods. That's it. It's that simple. You don't need to follow some special freaky diet. Just eat as close to natural forms as possible. 1 ingredient foods that don't have a barcode, basically, right? What's a 1 ingredient food? It's an avocado, right? There's no ingredient list on an avocado. There are so many things that spike our sugar every day. And this is one of the things that is showing up across time in our, data collection. Sugar in the morning will spike you quickly. I've been guilty of it. I ate this breakfast cereal. The marketing looked all fresh and healthy. Come to find out, it had 36 grams of carbs in it. And what was happening to me was I was eating this bowl of cereal in the morning. It had the fiber. It had some other things that were good for me. But then about 9:30, I'm hungry. And, but it's not a hunger issue. That's the thing. I felt hungry. I thought I needed to walk by the cafeteria or the vending or get a cup of coffee. But really, if you look at this from an evolutionary lens, a drop in your blood sugar, because that's what happens. You have this bowl of sugar, you have a great spike in your sugar, but you also have a great drop in your sugar. And that drop in your blood sugar, according to our evolutionary, creation, is a threat to your survival. And so what happens is when you have a hard drop in your blood sugar like that, your body's like, oh my gosh, it knows that a low blood sugar could kill you. So your stress hormones like adrenaline and cortisol spike to avoid that drop in blood sugar. And so this is really important to remember. You want to have proteins, you want to have carbs, you want to have a mixture of all of these things with all of your snacks and all of your meals. The things that I have found to help me eat healthier are really kind of founded in science, one of which is the fact that the brain is a very associative organ. We associate certain behaviors in certain locations. If you have a habit of eating ice cream or Cheez-Its on your couch or in your bed where you watch television, that continues to be a habit. You're sitting there watching TV and you're like, ooh, ice cream sounds good. And the next thing you know, you have a spoon in your mouth and you're standing in front of the freezer. So if you can break some of those habits of the location where you're at, if you can get up and go clean out a closet or take a shower, flip the laundry, do something different that breaks up those cues that typically suggest it's time for ice cream every night, that can help you. I read somewhere, or maybe it was a podcast, I think it was a Mel Robbins podcast. There was a doctor on there who taught me about how to face your cravings. It's a little complex, but I want to try to share this information with you. The physician said that he faces cravings with a 3-step approach, 3 F's. You're going to feel, you're going to feed, and you're going to find. Okay. And so that first F of this equation, when you have a craving, right? Craving for sugar, because many of us are all trying to break up with sugar, who's been our best friend for the longest time, right? So if you have a craving for sugar, the first thing you need to do is you need to identify what you feel. Is this a physical hunger or is this an emotional hunger? We need to create a pause, right? A little gap between that stimulus of what am I feeling and that response of I have a spoon with ice cream on it stuck in my face. So we could just use a couple nights ago, right? I'm sitting there and I'm watching TV. I'm watching, this thing on PBS. And I thought, oh, I'm kind of hungry. And then I thought, okay, time to bust out them F's. What am I feeling? Well, I'm not really hungry. I ate like an hour ago and had a really good meal. But what I was really feeling was stressed. I was feeling stressed. I had been on a bunch of Zoom calls, hadn't had contact with human people. I had a big talk coming up the next day. I had this kind of resting on my shoulder that I needed to be reviewing my slides, but I wanted to relax a little bit. And so I was just feeling a little bit of angst, right? So creating that self-awareness in our body can solve so many problems beyond just having a gap where you make your decision on how you're going to treat this feeling. But in our life, right? Don't be a Karen. Check with yourself first. Look at your emotions. And it can solve a lot of problems, one of which is cravings. So I'm checking in with myself. Well, I'm not hungry. I'm just emotionally a little bit stressed, right? So that's the F for feel. How am I feeling when I eat that ice cream? Because if I'm telling myself that I'm hungry, but I'm really not, and I'm stressed, how does food help me being stressed? Well, if I'm honest with myself, in a short-term plan, ice cream does make me feel a little bit less stressed. So I start to think about this. Well, I got this big talk tomorrow. I'm feeling a little bit stressed, so I feel like I'm hungry, but I'm feeling stressed. So what else could make me feel as good as that ice cream would? Well, let me think about that. That's going to be probably the F part. Let's find something else that can make us feel as good as ice cream can. So in that situation a couple nights ago, I thought to myself, I like yoga. Turned my phone on a little YouTube stretch thing, rest and restore, did 5 minutes of yoga. That feeling of I'm going to shove a spoonful of ice cream in my face went away. And so that little 3-step process of discovering how you feel, what are you really trying to feed inside your body, and finding something to do besides feed it with food is a great way to be able to handle your cravings. It's just this three-step process that kind of creates a gap between the stimulus and the response. And the most important step out of all of those, 80% of the work, is pausing and saying, what am I really feeling here? And listening to yourself. And so that's how I get rid of some of my cravings. The second area of focus is moving your body more. Finding ways to move every day can help your heart health, and it also gives you these wonderful feel-good endorphins that can help your mind function just as well. And so this I know came from a Mel Robbins podcast. I learned this trick that is really my keystone habit in my life. I love coffee. If you can't tell, I absolutely love coffee. I go to my kitchen every morning. It's one of the things I do ritualistically, habitually, just like brushing my teeth. I measure my water, I pour my coffee, I start my brew, and it takes 5 minutes. I don't go to email. I don't go to scroll. I don't tidy up the kitchen. I do a 5-minute strength training workout in my kitchen in my PJs every day. I do push-ups on the counter. I do just some stretches. I'll do squats. I started storing a kettlebell underneath my kitchen sink because what else do you put under there anyway, right? I mean, I don't even know what else is under there besides my kettlebell. So you set yourself up for success and you know that you can count on yourself for this 5 minutes every morning. Because one of the most important things I found across time and studying people, being a health coach, being a nurse, is that every day we ask ourselves subliminally, can I trust myself? I'm setting myself up to succeed with some goals for either weight loss or sleeping better or moving more, whatever that might be. And always in the back of our mind, we have this question of, can I trust myself? Can I rely on myself to do this? Because we doubt it. Because half the time, most of the time, we're failing at these things. We think we're failing, but what we're doing is we're failing with our approach on how we're trying to get going on these habits. And so what this 5-minute kitchen routine really does is it shows me that no matter what, super busy or not, I can count on myself. I can find 5 minutes of every day to count on myself. And it shows me that I can trust myself and I can rely on myself. And, people think, is that really that big of a deal? Yes, because research shows that if you commit to yourself and you show up for yourself, downstream, you're going to make better choices for your health that day. You're going to maybe make a better choice with your lunch, right? We are going to become humans that know our self-worth and we know the value of us, and we're going to treat ourselves with the value that we deserve. And so for me, this 5-minute commitment has been so powerful, and it's built this strength inside of me that's like, I'm going to do this 5 minutes no matter what. And it's a pride thing. And I think that this has been one of the best tricks I've ever done to be able to get my body motivated to move more. We're all standing there, letting the dog out, standing at the doorway, watching that cute little furry baby do its thing. Well, we could also be doing some stretches. We could also be doing, some squats or some leg lifts or, move some cans of green beans, right? Whatever we can do in that 5 minutes. So that's what I do to move my body a little bit more. The third area of focus that I think is the most important to reduce your risk of heart disease, and I know it sounds crazy, but it's sleep. Sleep is a superpower. I have done a whole nother talk about sleep, and I'll link it actually in the email with this recording. I just feel as though this is such important information and people don't know about it. When you're sleeping, there are so many amazing things that happen. This is when we have the repair of our cells and our tissues and our blood vessels. It's like going to the fix-it shop and you got all these dents and scratches on your car and they buff it all out and make it all pretty. That's what sleep does for our brain. It builds a stronger immune system when we get a better night's sleep. It improves our mood and our energy. And it helps us with our focus, our learning, our reasoning, our problem solving, our emotional control center in our brain. So much happens when we're sleeping. It is clearly your superpower. So people think that, what they need to do is think about their routine before they go to bed. But really, getting a good night's sleep starts in the morning. Natural light is a fantastic way to help your overall well-being. It is going to do something called set your circadian rhythm. This is your biological clock. Every single cell in your body has a clock, and this will set your clock for sleep. Having a regular set sleep time, getting sun or light in the morning on your face are incredibly important, okay? There is research study beyond research study that shows if you get 5.5 hours of sleep compared to if you got 7.5 hours of sleep, you eat 22% more calories when you only got the 5.5 hours of sleep. So you need a routine. Evidence-based, it says the best thing for regulating your sleep is a schedule. Alarms are not just ready for waking us up, okay? You can set an alarm to get ready for bed too. That is okay. I will say no to social engagements if it's going to ruin my health hygiene for sleep. It is so important. Make sure you dim those devices. Make sure when you go into the brightest room in the house, called the bathroom, and flip on the light and pick at your teeth for a couple of minutes before bed, don't do that. You're shutting off that melatonin faucet in your body by turning on that bright light. I got a little lamp I got at Savers at the thrift store. I turn on that little lamp, brush my teeth, do my thing. I want to keep that melatonin, that natural sleep hormone flowing in my body. Make sure that you're not using, your iPad or your television without a filter. That light affects your melatonin doses. So it's so, so important. I'm going to link the talk about sleep in my my email video that I'm going to send you guys. I cannot emphasize it enough. Sleep is a superpower. So missing from this is a lot of other information about pregnancy and miscarriages and preterm labor and gestational diabetes. These are all very important things to talk to your physician about if you have these risk factors that can affect your risk for heart disease. It is so important to make sure that after this talk today, you make a list. Jot some of these notes down to be able to talk to your physician about it. You need to talk to your doctor about your risk factors for heart disease. Prepare that list before you go and use your phone when you're there. Say, hey, can I record you? All you have to do is act like you're texting somebody, hit that little record button, and simple enough, you're recording that conversation. And that's important because most of us can't remember half the things that are told to us. And so having that and being able to share it with other people later is such an important tool. It's also important to be extremely honest with your healthcare provider. If you smoke, let them know. If you use marijuana, let them know. Medicinal marijuana, is legal in Missouri. But we have another talk that we put out by our pharmacist. There are some medications that you take that interact, heart medicines particularly, that interact with marijuana. So please be honest. If you're sharing just part of what you're doing at home with supplements or a weight loss drug that you're buying online. These are important things that can impact your heart risk. And so make sure you're honest about it. The other thing you always want to make sure you do is get your cardiac calcium scan. I'll scan in a flyer too and connect it to this email so you can have it. And it's got the number to call to schedule that. I think that's just such an important tool. So a lot of times, what ends up happening is, women just don't take action against their heart disease. They think that this is a man's disease. They don't make it a top priority. And some people may think that they're too young to be at risk, or they're too busy, right? Or they're too stressed, or they, are just tired. Well, guess what? Tired is a risk for heart disease. So we have to take action. Thank you so much for joining me today and learning about the prevalence and the risk factors and the quick things that you can do to help improve your risk factors against heart disease. So I appreciate you. I'm going to send this out in a YouTube link with all of those, little tools that I've talked about. Thank you so much for joining us today and have a beautiful day.